Hi, welcome back to the channel. This is Jen, your Medicare and retirement guide. And today we're continuing our ongoing series with I have an aging parent and I have no idea what I'm doing. So I'm just going to use this girl on YouTube to educate me, which is fantastic. And if you like this kind of content, please like, subscribe, comment down below on what kind of future content you want me to produce, and I'll go ahead and answer all your questions. So today though, we're going to be focusing on choosing the right plan for your parent once they hit that Medicare age. So, internet's most searched question for this topic. 1. What is the difference between a Medicare supplement Medigap plan versus a Medicare Advantage plan? Now, if you haven't seen it already, I've actually done a video on this channel showing the pros and cons between Medicare supplement versus Medicare Advantage. So if you haven't seen that, click on that video after you're done with this one. But to give you the quick and easy, Medicare supplement pays what original Medicare does not. So when your parent turns 65, remember, they have to go to Social Security office and go and request their Medicare A and B. That is known as fee-for-service traditional Medicare. That's just their basic coverage. Now, Medicare fee-for-service traditional Medicare is the largest network of doctors in the entire United States. Almost 80% of all doctors take traditional Medicare. So it's the largest network. However, it is not managed. So that's where Medicare Advantage comes in. If your parent wants to be managed, and what does that even mean? So when you have traditional Medicare, you want that access to 80% of all the doctors in all of the United States? Okay, maybe choose a Medicare supplement plan. Remember, it does have an additional monthly premium. It is a little more pricier, but at least your parent doesn't have to worry about, like, does this take my insurance? Do they take, this Medigap plan? Answer is yes, because the Medigap plan is the secondary insurance, because the first and primary insurance is going to be traditional Medicare, their A and B. So that's the benefit of getting a Medicare supplement plan. Now, the con would be it is not managed care. So your parent will be responsible for finding and asking and trying to figure out what doctors, what specialties can I go to within my zip code. Hopefully I can get an appointment as soon as possible. If they don't want to go through that process, then you have Medicare Advantages. So Medicare Advantages is that they're going to have their dental, vision, hearing, and prescription drug plan included in their all-in-one plan, and they will be managed by a medical group. So the medical group will be responsible for setting up their appointments, finding their specialists, coordinating their care, and making sure their continuum of care is all in one medical group. So at least your parent doesn't have to think about that. So pros and cons of each one, try to see which one will best benefit your parent. Now, the next question here is, how do I compare plans and know which one is the best for their health and their budget? Excellent question, because I don't think people understand how complicated this can get the moment you want to consider their doctors, especially if they have multiple doctors that they do not want to lose, and see what plan is going to cover all of their doctors, especially if they can't afford a Medicare supplement plan. In addition to that, you have to look at medications, their health conditions, their travel needs, their income, and then to top it off, if you want to consider all of those things into one plan, sometimes the Medicare plan finder is not going to have that nuance, right? Like they're going to be like the Medicare plan finder is going to give you a lot of really good general information, but it's going to miss the nuance. And what do I mean by that? I mean that this is where a licensed agent can help, because the licensed agent, when you have a really good experienced one, they can see certain things that you cannot, right? They're going to see, like, okay, what plans are going to give your parents longevity? If your parent is someone that's like, no, I want one plan that will cover everything for as long as I can stay on this plan. I don't want to switch plans. I'm not those types of seniors that switches from plan to plan every other year, to get the most benefits. I want the plan that will give me my doctors, my meds, meet my health conditions, my travel needs, my income, all in one. Then you want to have a licensed agent who knows your area well recommend and see which plan is going to give them that longevity. So always make sure you double check and make sure you just have someone trusted to go ahead and give you that guidance and that information. Now, the next question we have here is, can my parents keep their current doctors if they switch plans? Now, if you opt to have a Medicare supplement plan, most likely, yes, their doctors are still going to take it as long as they are contracted with Medicare. If they have a Medicare supplement plan with traditional fee-for-service Medicare, 99% of the time that doctor is going to keep seeing your parents. It's not going to be a big deal. Now, with Advantage is the one that you need to be a little bit more careful with, right? Because now you're talking about switching your parent from one medical group to a different medical group, possibly. Now, if they want to switch like from one insurance company to another insurance company, you can keep them with the same medical group and they keep their same doctors. Not a big deal. But let's say your parent wants to switch from one insurance company and this new insurance company is not contracted with that medical group. That's where there's a little bit of MacGyvering that has to happen so that your parent can still stick with the same doctors. Maybe they have to change to a different medical group, but maybe that medical group is going to keep all their doctors together. And so that's, again, if you have a trusted agent, then they can go ahead and explain that process to you and then figure out what is going to be the most important thing to your parent. Are you going to be okay with not having certain doctors, keeping the most important doctors, maybe losing a couple that you're like, I just see them once every couple years, it's not a big deal, etc., etc., etc. So just make sure that they go ahead and go over those important details if those things are important to you. Next question here, are there plans that include dental, vision, hearing? Yes, Medicare Advantage. Medicare supplement plans do not. You will have to buy a standalone policy. They're usually called DVH, dental, vision, hearing plans. That is an additional cost, and that is an additional monthly premium on top of the Part D prescription drug plan and on top of their Medicare Part B monthly premium. So, Medicare supplement, there is a lot that goes into it. There's a lot of extra charges. You have to pay the Medicare Part B premium, the Medicare supplement premium, the prescription drug plan premium, and you need to find a dental, vision, hearing plan. We're talking 4 premiums altogether per month. So it is a little bit pricier, but you have that flexibility. So those are certain things that if you can afford it, that would be that's fantastic. And you are in an echelon that, can go ahead and go to any doctor, see anybody you want, and not worry about, do they take my insurance plan? Yes or no? But not most Americans are not in that echelon. So they have to go ahead and probably choose something like a Medicare Advantage plan to go ahead and include all of those in a monthly plan with a $0 premium. A lot of them start at a 0 monthly premium. So at least all of that is included in your Medicare Advantage. Again, it's just, what are you willing to compromise on? Last question we have here is, what happens if they travel out of state or move? Will they need a new plan? Yes. If they move out of state and they're switching to a different zip code, yes, it would behoove them to go ahead and switch the plan to their state so they don't have mysterious out-of-pocket, bills coming in the mail if they end up seeing a doctor in that new resident state while having the old insurance in a different state. So that's something to keep in mind depending on, what is their current situation. Now, if they travel out of state, that's a completely different situation. Then they can go and stick with their Medicare supplement plan because, again, remember, traditional Medicare, largest network of doctors in the entire United States. 80% of doctors take Medicare A and B. So Medicare supplement can go ahead and cover them as they're traveling across. Advantage plans are regional. So more often than not, you need to make sure that when you sign up for a Medicare Advantage plan, if you're going to be traveling on a consistent basis, maybe look into possibly a PPO plan. See what they offer in terms of travel when you go to different states. If you stick with an HMO plan, just keep in mind that you may get a separate bill in the mail if you end up in the hospital or in the ER or in urgent care in a different state. Just make sure you look at your evidence of coverage and your summary of benefits. Ask the company, ask your agent to give you that information if you're somebody who travels on a consistent basis. So for now, those are the most asked questions about choosing the right plan for your parent as your parents are aging. If you like this type of content, please consider sharing it. Like and subscribe below. Always ask questions in the comments and I'll go ahead and answer any of those questions that, are stressing you out. Let me alleviate that. And as always, remember, link in the description down below if you would like me to review your benefits. I would love to be your agent. Other than that, thank you so much for watching and I'll see you in the next one. Bye-bye.